Depression versus a horrible life. I'm Dr. Adam Millman, thank you for watching. At the internal medicine practice that I work at in Las Vegas, Nevada, we see a multitude of health problems. Unfortunately, what is becoming more common over the last few years is it increases in the incidence of depression. And there's lots and lots of reasons why this could be. So I'd like to discuss what is depression and what it probably is not, causes of depression, and how do you deal with it. So people will often present to the office and say that I have depression, or I have a history of depression, or I've battled depression. And the way it's often described, and the way it's described in that way, it almost makes it seem like it is a physical thing. So if someone were to come in and say, I have breast cancer, like literally I have breast cancer, that would mean that there is a cancer inside of the breast. If they say that I have heart disease, then objectively we could find in their heart problems with its ability to pump, its the rhythm, the rates, and there you could see the objective effects if you looked at it with the appropriate imaging. But when people say that I have depression and describe it as if it's a physical thing that you could hold in your hands, that it makes it a little bit more complicated, because for sure, with as debilitating as depression is, it is not quite the same thing. So when people have depression, they probably move in and out of depression at different states. And it is not there all the time, although it could be there most of the time. But in the end, the depression, for whatever the cause, and I will go through that in a second, the end result, you could summarize the end result of depression, whatever the cause is leading to it, the way Dr. Jordan Peterson describes it, as a deficiency or dearth of positive emotions, a inability to experience positive emotions, and a preponderance of negative emotions, in a large amount of negative emotions. And usually if you have one negative emotion, you will have another negative emotion. So if you feel sad, you often have a poor self-image. If you have a poor self-image, you may have lack of motivation. You may have lack of strength, physical strength to get up and do something. You may also have paranoia. And they all seem to go together because of the causes in the brain, social experiences, life experiences that lead to this effect. Some of it is regulated by the brain, certainly those that have decreased serotonin in parts of the brain. And this can be affected by having a poor self-image, both in human beings and animals all throughout the world. If the way they perceive themselves, often affected by how they believe other people perceive them, will regulate and decrease the amount of serotonin in specific parts of the brain, making it more likely that you will succumb to negative emotions. So when something bad happens, if you have lower levels of serotonin in specific parts of the brain, you may have a greater anxious effect, greater stress effect, a more sadness, where someone else that has higher levels of serotonin in specific parts of the brain, they will be able to deal with the stress, with the anxiety, and the event will not affect their self-conception, meaning how they see themselves, and it will not spiral out of control until, as again, Dr. Jordan Peterson would describe, as a destroying of one's own self-conception. So something bad happens, having poor levels of serotonin in specific parts of the brain will prevent this bad event from being kind of compartmentalized and bound to just the specific event, rather than affecting how you see oneself. So something bad happens to you, it could, without the appropriate levels of serotonin, without the appropriate way of thinking, it could completely spiral out of control until you're a horrible person. Maybe it's better if I wasn't here. So you're not so nice to one of your friends. People that have depression, and the way it spirals out of control would be something like this. You would say, I hurt one of my friends. I often hurt people. I can't really control my words. Things that come into my mind, I say them and I can't really control what I say. And it often winds up hurting people. And I've been like this for a really long time. And there's a good chance that I'm going to be like this in the future. I've tried to change and I haven't been able to change. I've sought help and it just hasn't worked. And I'm not really sure what it is. And if I look back, I think of all the people that I've hurt in my life and how I've made all these mistakes. And this is probably going to happen in the future. And you know what the truth is? I'm not really such a good person, because if I were a good person, this is not the way I would behave. And I haven't been able to stop it, and I'm probably not going to be able to stop it in the future. Maybe it would be better if I just wasn't alive, or if I would just hurt myself. So when people are not able to control and limit the event that happens, the stressor that happens, or a mistake that they made, to just that specific thing, instead of saying, I've hurt someone. Occasionally I hurt people. I'm not perfect, but I am trying, and I think I can get better. But I do good things a lot of the time, but sometimes I really do mess up, but I could apologize and the person would probably forgive me. Rather than it just destroying who you are, because something bad happens, and it's always happened. It'll probably always be that way, and it affects it. It's because of who I am as a person, and then that's not going to change. The people that have low levels of serotonin are more likely to succumb to this cascading effect where the bad event destroys what you think of yourself, and to the point where it would be better if you weren't even alive. The people that have the appropriate levels of serotonin and appropriate ways of thinking and understanding the stressors, this is less likely to happen to. So what causes the depression? Well, certainly life experiences, trauma as a child, divorce of the parents, loss of a parent, loss of a sibling, loss of a grandparent, move to the other side of the country, something traumatic, obviously war and catastrophes. Physical illness can cause it. Genetic causes. Some people do not have the ability to bring the appropriate amounts of L-tryptophan across from the blood into the cerebral spinal fluid to get into the appropriate parts of the brain, so they can't make serotonin. Other people have a problem creating the serotonin in their brain. There's genetic predispositions too. There's changes in the morphology of the brain. Higher levels of stress can cause it. Physical illnesses can cause it. Physical illnesses, pain, rheumatoid arthritis, lupus, increase certain inflammatory chemicals in the blood that affect what's going on in the brain, leading to depression. So sometimes you're depressed because of the physical pain. So you could say, well, I'm sad because I have the physical pain. No, you literally are sad because the physical pain has an effect on the brain. It's not just I feel bad for myself because I have pain. You can literally have more depression because of a physical illness. And there's in some studies decreasing the inflammatory modulators, the inflammatory markers in the body, things like C-reactive protein, tumor necrosis factor alpha, interleukin 6. By giving medicines to decrease these, you can actually have a direct effect on the brain and enhance mood, even though we're not really treating with antidepressants. So that's an interesting thing. So, and the antidepressants seem to have an anti-inflammatory effect. So for the people that they work, there are benefits, and the mechanism is not totally clear. They start to increase serotonin levels in the brain right away, but the effects can take weeks to work. So it's more complicated how they work. I use medications in patients that request them, and then also in situations where the depression is very, very severe. And the way you can look at it is, even if you don't want to take the medication and you want to try something else, if you're dead because the depression is so bad that you kill yourself, then this would be tragic and you never have a chance to improve anything. So if society creates something, if science creates something that can have a benefit, it's at least worth it to try until you get all the other things in your life that might not be quite the way they should be in line. The medications can help, and stopping them at a later date would be acceptable with of course, in discussion with your primary care doctor or psychiatrist or counselor. But certainly medications do play a role, especially for when patients are very, very severely depressed. But I did want to differentiate between people that say they have depression versus people that have a horrible life. So there are people where they have all the money they could ever want. They have a wonderful family. Everyone has their physical health, and they still do not feel good. These people that are incapable of experiencing positive emotion, where they have all the things that everyone would think would be necessary in order to have a happy life and to have happy emotions, there are people that just don't have them. And in those patients, there is a mismatch, so to speak, between how good their life is objectively and probably subjectively, and how they feel physically. And in these people, I like to call it the anti-placebo effect. Many of these people do not want to take antidepressants, but their life is fantastic. They don't really need to go to therapy. Their self-image is good. They have money, they have security, and yet they still don't feel good emotionally. And those people, antidepressants seem to work better than you might expect. And many times they don't want to take them. So when they work, I call it an anti-placebo effect, because quite often when you tell people that a medication is going to do this, they will experience it even if it's a sugar pill. There's interesting studies where you give somebody a medication that's supposed to that induces vomiting, but you tell the patient, they're old studies, not so entirely clear that it's ethical, but you give a medication to someone that is used to help them throw up if they were to ingest the poison, but you tell them it's a medicine that's used to treat nausea, and then all of a sudden their nauseous symptoms seem to go away, even though it's a medicine that causes them to throw up. You can tell people that you're giving them medicine that will make them tired, but it's actually a stimulant. And it will have a sedating effect, even though it's a stimulant. And you can give people a sugar pill, and they will often feel better, especially in the depression studies where you tell someone you're giving them an antidepressant and it's a sugar pill, and you give them counseling, and they do almost as good, or they do almost as well as in the patients that get counseling and an antidepressant. So there is a tremendous placebo effect depending on what you're trying to treat. But in people that really don't want to take an antidepressant, and then they do and they actually feel better, then there's probably good evidence that it is actually working. Now, it's a little bit more complicated as well, because then there are patients that say, I have depression, and you go through a list of their life. And eventually it turns out, say it's a young man, and he's living in his divorced mother or father's basement. He's 30 years old. He's spending 8 hours a day watching internet pornography, spending lots of time on social media, looking at everyone else's life, clicking up, clicking down, responding to what other people are saying in their posts and the videos and pictures and someone's comments on someone else's post. And they don't have a job. They're not making meaningful contributions in society. They're not taking care of themselves physically. They don't have friends. They don't have a girlfriend, they don't have a boyfriend, they're not involved in any civic duties or charity, they're not going to a church or a synagogue or a mosque or a temple. They succumb to their own temptations with alcohol or overeating, cigarettes, maybe drugs when they have enough money. They're not exercising at all. They don't have any worthy goals. They're not moving towards the future, not moving towards something, maybe because of how depressing their life is. These people most likely do not have depression, they just have a horrible life, or they have a terrible life. And then throwing an antidepressant at them, giving them Prozac or Paxil or Lexapro or Celexa or Effexor is probably not going to fix all of these problems. But how it may give them enough energy, it may get rid of it may increase the serotonin and some of the other chemicals that may give them an ability to deal with some of the major stressors in their life and give them slightly more energy to get off the couch and then go do something. But the chances of an antidepressant fixing their life when there's so many of their things in their life are not going well, the chances are very, very small. I advocate for people to get up, get out of the house, turn off their phones, get a job, even if the job is below where you think it would be. Without a job, you don't have the structure. You're not making meaningful contributions. You're not earning any living, and it's going to start to weigh on your psyche. It will start to make you sadder that you're not making contributions and you don't have the ability to support yourself and you don't have that structure. Going to a church, going to a synagogue, a mosque, a temple. Now, you don't have to agree with what everybody says there. That's pretty unlikely that you'll find something. But chances are you're going to find a bunch of people there that are interested in something besides themselves, a higher power, purpose in life, charity, improving themselves, community, not just focusing on your own problems. Being around that group of people is probably not such a bad thing. Becoming physically active is going to change the way you feel. You will feel physically and emotionally better with even a little bit of exercise. Now, say you don't have enough energy because you're feeling so bad about yourself, you can't go to the gym and work out for an hour. But can you get up and walk around the block? Can you at least go outside? And then maybe the next day you walk to the end of the driveway. Could you at least turn off the phone? Or if you have to watch the phone, maybe you could walk in place. You could do some jumping jacks. These things are the necessary, so to speak, structures that can help insulate you and support you so when things start to go poorly, they don't spiral out of control. To have a social network of friends, to have a significant other, to have a church, a community, to volunteer and give to other people takes focus off of yourself, and you will feel better about yourself by helping other people as a byproduct, not as a goal, but as a byproduct. Getting rid of some of the vices, getting rid of the alcohol and the overeating, shutting off of the phone. But when people just sit at home and they look at the lives of other people and they see how their life is not like that person, their pictures don't look like their pictures, and specifically with young girls and women, they're looking at pictures of someone else and what they're doing and how their life seems to be great, and the family looks beautiful and the house looks beautiful and the appearance looks great, and trying to. And maybe not being aware or intentionally deluding yourself, thinking that there wasn't modification of the picture and things weren't made to look perfect right before the picture or the video. And this, unfortunately, is what happens. People think that person's life looks good and my life it does not look like that. And people, specifically women, are susceptible to these comparisons with what other people look like online. So putting these structures in place, having a friend, having some friends, focusing on the friends, a meaningful relationship with a significant other, being involved in a community, religious institution, civic duties, mentoring of other people, getting rid of the vices, getting rid of the internet addiction, getting some physical activity, job. All these things can help put like a structure around you so when things go wrong, it doesn't spiral out of control and destroy your life emotionally. A medicine can help with that. A medicine, depending on the medicine, if it's something like Wellbutrin that increases dopamine, it will help you want to move into the future, which is what dopamine drives us to do. Evolutionarily, it helped us move forward to acquire food, to acquire a mate, and to seek shelter. Now it's to accomplish other goals, to move forward into the future, to accomplish something better. And every time you achieve something, a little bit of dopamine is released so that you remember those events along the way that got you there, and it makes it more likely to happen because now you've activated the parts of your brain that are responsible for moving into the future. So if Dr. Jordan Peterson uses the example of cleaning out your sock drawer, it's difficult to do. You have to overcome it's been in there a long time. It's a big project. I don't think I can do it. I mean, you really can't underestimate how difficult that can be for somebody. But once you go through it, you take out the socks, there's a bunch of holes in them, you get rid of these aren't stylish, you get rid of those. And now you've cleaned that out. Now you've set a goal, you've accomplished it, even though it's small, you've activated the parts of the brain and increased the chemicals in the brain that are responsible for moving you into the future for the next project. And you see that you could accomplish something, and now you're more likely to move forward and accomplish something else, a slightly bigger goal. So the person that's so debilitated with no energy at all, they can't get up and make dinner, you could certainly put a napkin on the table. Could you put a spoon on the table? How about a fork? Could you put a plate on there? Could you at least stand up? Could you at least move towards the table? Could you at least take a pot out? And by saying, I'm going to do this and then accomplishing it, it starts to get the gears rolling, the gears moving, increasing the chemicals in the specific parts of the brain, the mesolimbic part of the brain, the prefrontal cortex, the commons nucleus, ventral tegmentum, that it makes it more likely that you will move into the future. And that medications like Wellbutrin that increases also called bupropion, will increase the appropriate chemicals, the dopamine, that makes it more likely that you'll go into the future. The selective serotonin inhibitors like Celexa, Prozac, Paxil, Lexapro will make it more likely that you will be able to deal with the stressors that are around you so that you don't completely spiral out of control. And the combination of the two different medicines can be very beneficial as well, because you're now buttressed against negative emotions because of the selective serotonin reuptake inhibitors. And then you can also move forward into the future and seek worthy goals and more likely to accomplish them, more physical energy, more focus, more goal-driven behavior because of a medication like Wellbutrin, which increases dopamine in the appropriate parts of the brain. But the medications, and then combined with these structures that you can put in place, the exercise and the friends and volunteering and religious institutions, civic duty, volunteering, all these things can help kind of put in place a force field around you, so to speak, so that your life is less likely to go out of control when things go poorly, and you're more likely to move into the future with worthy goals and the ability to accomplish them, plus the structures in place so that things don't go out of control when things go poorly. So there are people that have severe depression for all kinds of reasons that we've mentioned. Genetic predispositions, bad childhood, physical illness, inability to get tryptophan into the cerebral spinal fluid, physical illnesses, rheumatoid arthritis, lupus, heart disease, bad situation going on around them. And there are things that we can do to treat them. And even if you're apprehensive about a medication, in the short run, it might be very helpful, and even in the long run. But for sure, it's not the only solution. But it is available to people from the appropriate provider with the right discussion about risks and benefits. They do play a role, but so do the other important things that you need to put in place besides just the medications, because there's chemical changes in the brain that can be modified, both with physical activity, better ways of thinking, and then of course the addition of medication. But one thing is not the solution. Going to church is not going to fix all your problem. Taking a medicine is not going to fix all your problems. With the exception of the people who have their life seems to be completely in order and they cannot find any reason to be depressed and they are still depressed, this could be to genetic predisposition, processing of the chemicals, increasing the chemicals in the right part of the brain, morphological changes in the brain, and those patients usually benefit from medication. But for the majority of people who there are things that are just not going right in their life, the medication is help, but it is not the only, but is certainly not the only solution. Numerous other things. Changing the way you think about a specific problem, how you talk to yourself when a bad event happens, can also be very helpful. So medicine, exercise, social structures, volunteering, civic duty, religious institutions, getting rid of the vices, and the social media to a large degree will certainly help. Thank you very much for watching.